Welcome, everybody. My name is Kim Porter. I'm the Executive Director of Be a Part of the Conversation. Thanks for joining us for this continuing education training. We have a returning champion, Jessica Molavi, with us today. I'll tell you more about Jess in just a moment. Thank you very much to our community partner, the Montgomery County Office of Drug and Alcohol. Very, very appreciative of their support. We're going to allow times after Jess's presentation for you to ask questions, hear from her, have some of her feedback, and would love to hear from you what you're experiencing either through your work as prevention providers. I know we have therapists and prevention providers and peer support specialists and lots of others with us. So thank you very much all of you for being here. We are recording this program. If there is anything that comes up during the Q&A that is personal, private information that really should not be recorded, we will edit that out before it is posted. I just wanted to assure you that your name, your image, nothing will be visible on the final product of the recording. When this program ends, there will be a survey that comes up. I say this every time, but I'm going to say it again. Please, please take a moment to complete that survey. It really does help us to hear from you. We need that feedback because we are supported by some entities like today's partner, Montgomery County Drug and Alcohol. They want to hear from you too. Like, was this helpful? What would you like to hear about in the future? So we really appreciate you taking just a few minutes to do that at the end.
And it's actually a Google form for this one because that'll be how you get your CEs from the Phoenix Center for Experiential Trauma. So it'll be a Google form, not a Survey Monkey. If you've been on a program with us before, it'll pop up in a separate browser in your window as the program ends. And I'll also put the link in the chat towards the end of the program. So just wanted to interject there.
That was the amazing Bob Lamb, who definitely reminded me this is a continuing education program, and we need that. So thanks, Bob. Yes, great. Thank you. We do have a lot of recorded programs in addition to this one that will be posted there in a few days, but they are on our YouTube channel, which you can get to as convo.zone/YouTube. We have a lot of content on there, so I hope you'll check that out. I also like to take every opportunity to make sure that you all know that we have a lot of services besides these kinds of programming that we do for communities and for behavioral health providers. We have support group meetings for parents, guardians, and grandparents called Parent Partnership. These are peer facilitated, and they meet throughout the region in person, and they also take place on Zoom. We have 21 meetings every week, 5 days a week. Amazing, amazing people who are leading these groups. So always so grateful to all of them. But you can click on any of these buttons on this page of our website to get more details, like the Zoom link or the address, the location, that sort of thing. We also have a family recovery course. This is a 3-part course that is for family members who have been impacted by their son or daughter's, their child's of any age substance use. So this is not a prevention program. This is really supporting the families who have been impacted by addiction. It's capped at 12 individuals. All of this is completely free to attend and led by 2 instructors. You get a manual. It's a really terrific course. We're about to be posting a lot more dates. You'll see on this page, we only have one date post, one series coming up at the end of June, but we will have a whole lot more posted in the next couple of days that will take us through December. So check that out. I do want to tell you about one program that we have coming up a week from tomorrow. We're doing this on a Saturday. We're very, very excited to have our first continuing medical education program. So this is for 2 hours of continuing medical education through the American Society of Addiction Medicine, or ASAM. We're partnering with Care and Treatment Center. We'll have 2 presenters. Libby Stout is a national speaker on this. She's an addiction psychiatrist out of Colorado. Amazing, amazing presenter. She's so knowledgeable, as you can imagine. She's kind of been boots on the ground with cannabis for some time. And if I didn't mention, sorry, this is focusing on cannabis. And then Mo Sarhan is a physician at Care and Treatment Center and specializes in addiction medicine. So we're really grateful again to the Montgomery County Office of Drug and Alcohol for supporting this and hope that you will join us. Okay, so in that link to, by the way, to register, conversation.zone/CME. Again, no charge to attend. Okay, so let me tell you just a little bit about Jessica Molavi. Actually, I'm going to ask Jess to tell you some more details, but she is a Gorski trained advanced certified relapse prevention specialist and has also received training in EMDR and trauma. She's currently the clinical manager of specialty services at Miramont Treatment Centers. Jess works to ensure clinical excellence in the treatment of relapse, trauma, pain management, and in support of first responders, LGBTQ population, and family systems. So I will turn it over to you, Jess. Thanks so much.
All right.
Looks great.
Wonderful. So good morning. Thank you so much for coming. As Kim mentioned, my name is Jessica Molavi, and I work for Miramont Treatment Center's inpatient substance use disorder program. We kind of recognize that there are sort of these subgroups within the population that we treat that may come with or present with certain cultural norms that the rest of the population may not relate to or understand around the level of trauma that they're exposed to. And really feel that in order to provide individualized care, we need sort of these carve out specialized services to meet the individual needs of each client. So, for example, as Kim mentioned, we have a program for first responders and veterans, people who suffer from chronic relapse syndrome, chronic pain management, family support services, LGBTQ, and what we're going to talk about today, a program for trauma. Our trauma services have expanded significantly over the years, which has lended to a lot of my expertise, both personally and professionally, looking at kind of the signs and symptoms of trauma, the impact that it has depending on your background, your history, how you present, and then a lot of requests as of recently have come up to get better educated about vicarious trauma. Historically, a lot of the research on vicarious trauma has been centered around professionals that are in the field and constantly exposed to workplace crisis and dysfunction. But I wanted to add some different research today for personal vicarious trauma as well. So in order to best understand vicarious trauma, we need to kind of have a bit of a history on trauma in and of itself. So looking at how to define trauma can be a little bit challenging because it's a very broad term with a lot of information, a lot of research, and a lot of language centered around it. So if we really want to simplify it down, it's a person's emotional response to a distressing or disturbing experience. It's important to note that events are traumatic to the degree that they undermine a person's sense of safety in the world. So, for example, if you kind of come from a generally, normal, I don't like that word because I don't think it exists, but generally safe background where your needs were met, you could trust people, nothing negative has really happened. And then you go through an experience where, let's say, an assault occurs. That is then going to interfere with a person's belief system in that it shifts because now there's a recognition that people aren't so safe. They are capable of hurting you. You can't necessarily trust everyone, and you may have to keep your guard up. So that is an example of how perceptions and beliefs can shift as a result of going through a traumatic event. And that would be an example of undermining the person's sense of safety. The experience made them feel unsafe, and the aftermath created a sense of being unsafe as a result of what they went through. Also important to note that trauma is identified by the individual person's perception and interpretation of the experience, not by what other people measure as trauma. So if I am working with a patient and they tell me something rather distressing, it's not really for me to say, you're traumatized or you went through a trauma. I could actually cause harm by doing that because the person may have effectively processed it, moved on, or their brain may have created a sense of denial in that they're not prepared or ready to address that level of pain. And people have a tendency to measure pain in order to justify it as traumatic. So, you'll see in a group setting, for example, if someone's talking about being in an active war zone, the person next to them may feel hesitant to share about an abusive spouse. They may feel like, okay, well, what they went through is real trauma. What I went through doesn't even compare, and tend to create reasons and barriers why theirs isn't on the same level. It doesn't matter what the experience is. It's a very old school historic belief that in order for it to be considered trauma, it has to be life-threatening. Trauma is anything distressing that creates a shift in us and lends to a lot of negative reactions and symptoms as a result. So it's obviously going to cause a very wide range of symptoms, a lot of which are very normal to have. As human beings, if we go through something distressing, we're going to have some uncomfortable reactions, feelings, and emotions. Some of these symptoms are going to be more immediate, and some of them, if they're not processed effectively, can linger long term. So if the symptoms are not recognized early on and addressed in an effective way, it might indicate that the trauma has progressed into something more severe, and or it can progress into an actual diagnosis. So I'm going to run through the different types of trauma. First, we have acute, which is going to reflect the intense distress in the immediate aftermath of a one-time single incident event. So typically, you have an event like a car crash or an assault or a, physical fight or an unexpected death of a loved one, right? These are single incident trauma events that are going to create normal reactions that typically persist for around 30 days. If you are experiencing symptoms longer than that, then it's time to get some help on board to be able to process what's happening. Then you have chronic trauma, which can arise from harmful events that are repeated or prolonged over the course of time. So this would be things like persistent bullying or childhood neglect or abuse or physical assault or sexual assault. Chronic trauma is going to have more significant impact on the person's belief system, their innate wiring, and their relationship dynamics and choices, which we'll talk about later on. This particular type of trauma, because it's not a single incident event, it's a series of events over the course of time, is really going to require ongoing interventions and modalities to really effectively treat the symptoms. With single incident, you can do a lot of techniques one time that are going to help, minimize the symptoms or process the symptoms. But with this type of trauma, it's going to be an ongoing process. Then there's complex trauma, which is very similar to chronic trauma in that the person is experiencing repeated multiple traumatic events. But the difference with this trauma is that there's an experience of no possibility of escape. The key feature with this particular type of trauma is feeling trapped. I can't get out. My life is actually being threatened or at risk. So obviously that's going to undermine the person's sense of safety, and it's going to trigger a severe stress response that causes something called hypervigilance, where people's response and baseline for stress will actually shift and elevate to be significantly higher than it once was, which makes them operate on a heightened level of stress all the time. So they may have a very difficult time decompressing or relaxing, like the person next to them would. This is the most common type of trauma we see for first responders and veterans. And I don't know, for those of you that have any relationship or are familiar with responders, if they walk into a social event, they are immediately aware of where all the exits are, who's in front of them, who's behind them, where there's a potential threat, how they would respond to that threat. They are fixated and hyper aware on anything that could create risk. And even when they've mapped it all out, they really have a hard time taking a deep breath and calming down and having enjoyment because they're always on heightened alert. Whereas you or I, as a civilian, probably wouldn't do that. We'd walk in, sit down, might be generally aware of our surroundings, but the paranoia and sense of stress isn't as heightened. So this is going to constantly drive an excessive feeling of being out of control and really causes a lot of long-lasting symptoms for the person's mental and emotional stability. Then we move into looking at more of the childhood range. There's something called adverse childhood experiences. And adverse is just another form of language for trauma or abnormal experiences. And this is going to cover a very wide range of difficult situations that children are either directly facing or witnessing while growing up before they've developed effective coping skills. So the difference with this particular type of trauma is that it will disrupt very important normal courses of development and really create emotional injury that can last into adulthood and will cause an impact in the way that it manifests in that person's adult life. So an example of this could be, as a child, you lose a parent very suddenly, there's neglect, there's emotional, physical, sexual abuse. Exploitation is a big one in this category. But it can also be things that are more common, like divorce, if the child isn't, properly supported in the process. Anything that's going to disrupt development and impact the way in which their needs get met would fall under this category. Then we have a little bit more of a recent diagnosis called post-traumatic grief. And obviously we know that any form of grief is going to be traumatic in some sense, right? But when that grief is sort of outside the scope of the norm or a little bit more intense or unexpected, It can cause lingering symptoms that people don't really process and move on from, that continue to impact their daily functioning in the present. So it mimics the same symptoms of PTSD, where, if the person is triggered by the loss or has an experience where there's a reminder of the loss, and the response to that trigger is impacting them physically, mentally, emotionally, or the overwhelming sadness and depression of the loss really impedes their ability to live life the way they once did, it would fall under this category. So, post traumatic grief will cause a disruption in the person's mental health, their emotional stability, and the way in which they cope with things in a healthy way. And, there's constant triggers when you're dealing with grief, whether it's an anniversary or a memory. And when a person is triggered by that, it activates a reenactment where they're in the very same feelings, experiences, and thoughts that occurred the moment that the loss happened. And that is very much how PTSD works. So now that we kind of have an understanding of the different types, we can talk a little bit more about vicarious or secondary trauma. Vicarious trauma is the accruing effect of being exposed to someone else's trauma. So it's going to cause some pretty unfavorable changes that are both affective and cognitive, so emotional and in the thought process, that result from the secondhand exposure. People experience trauma directly and go through things, obviously, but they can also experience things indirectly through someone who is also experiencing something. So if you are connected to someone who directly went through a trauma or event, that can indirectly spill over and cause trauma symptoms or impact your emotional or mental well-being as well. It's very difficult for people to recognize or acknowledge because they feel like, well, I'm not the one that went through the trauma, so I shouldn't be affected as much, or they won't give themselves the same level of room to recognize where they're negatively impacted because all of the focus tends to go on the person who directly experienced it. And rightly so, but when we are connected to someone else who is in immense pain and suffering as a result of a difficult event or a distressing experience, especially when you are very empathetic and compassionate in nature, it's going to create risk that then becomes internalized by you and you start taking on the trauma symptoms as your own, and it can actually lead to symptoms of PTSD. This type of trauma is typically going to involve a change in personal beliefs about self, others, and the world. So, what do we know about vicarious trauma? In the early 2000s was really when the term vicarious started to become more normalized. It wasn't a common, language that was used within the clinical field, but it was really starting to come about as a result of some research that was done looking at long-term therapists' exposure to clients' traumatic stress. So again, we're not the ones who went through the assault or, the sexual molestation or the abuse from a spouse, but we are constantly listening to it for 8 hours a day for years at a time, right? Similar to a first responder who didn't go through the car wreck or experience the awful, drowning, but they're the ones first on scene. They're the ones meeting the needs and duties of everyone around them. They're the ones that cannot emotionally react in order to successfully help the circumstances. And as a result of that, people started to look at the impact it can have in a professional sense. Then you have, today with the increase of things like the pandemic, violence against social unrest, political issues, road rage, airplane violence, and other various behaviors that are a little bit more progressive than they may have been 10 years ago, people are more likely to be exposed to secondhand accounts of these things and not recognize how they may be affected. When we're constantly exposed to high stress situations, we can become hypervigilant to that traumatic material without even knowing what happened. And as a result, we can start to develop these innate fears that we're not even aware of, which can lead to a tendency to avoid certain situations, certain places, and really struggle to have a deep understanding of why this impact occurred. So for those of you that may have known somebody post-pandemic, really it became difficult for a lot of people to break out of isolation. It became so normalized, and the level of experience they had that is trauma focused around that isolation made it hard for them to re-engage socially with other people. through research in like neuroscience, evidence really shows that when trauma is survived by a human being, the brain as well as the body is going to hold traces of the experience, what we call templates or imprints. Because when we go through a traumatic event, it's not just mentally impacting us or emotionally impacting us. Physiologically, when it's not processed effectively, it gets stuck in the brain and in the body. And that's why when someone is triggered, they have what we call a somatic reaction. So I once was working with a firefighter who survived 9/11, and we were doing some intense trauma work, and a plane flew over like it does every day, all the time. It was particularly loud and a little bit low. And when I turned around, he was on the floor in the fetal position. Now, that trauma had happened 20 years prior, but the sound of the plane triggered him, and he reacted physiologically as if the trauma was happening again right now in this present day moment, because he didn't have conscious control over his wiring once he was triggered. So he did exactly what he did to survive in that very moment, which was fall on the floor and put himself in the fetal position. That's a more extreme example of post-traumatic stress disorder, where you are traumatized and the trauma is not properly processed and stuck. And so, more notably with vicarious trauma, we have now found that these somatic reactions can also occur, along with these emotional artifacts or memories shared by people surrounding the trauma can also imprint on the brain and the body of the person receiving it or being exposed to it or witnessing it. Whether you're directly or secondhand experiencing or hearing about the account, it mimics the same as a firsthand direct experience with the trauma. So templates get formed all the time over the course of time. And it can really impact our overall perceptions, our belief system, and ultimately our wiring, which we don't have very much conscious control over. So I put an example in just to show people kind of what this looks like. So let's say we have a parent of a teenager who was suddenly assaulted at a high school event. The assault, which would be the identified trauma, happened directly to the teenager and would cause typical symptoms and reactions of acute trauma, right? Paranoia, high levels of stress, aggression, excessive fear, mood instability. For the parent, symptoms of trauma can also impact them in the sense that they become heightened in stress. They're now hyper vigilant. Where are you going? What are you doing? Who are you going to be with? They can't relax unless their child is in front of them and they can physically see that they're safe and okay. They'll have ongoing experiences with negative emotional distress because they know the level of pain that their child must be in. They become extremely angry and aggressive over the fact that it even happened and that the world is a place where it's capable of occurring again. And any kind of future risk or reenactment or trigger for this particular event would cause a physical response in the parent. So like, if the child is stepped into the street too soon and a car came, you're more likely to have a hyper-reactive response after something like this than you would prior. And your beliefs and perceptions would go from, the world is generally a pretty safe place and you can ultimately trust people to help out, to the world is not a safe place and I have to keep my guard up at all times. Prior to that event, there was no exposure to anything that would cause people to question humanity. But after the event, it shifts focus and it really impacts the way you see yourself, other people, and the world around you. And so, trauma doesn't only impact the person who directly experienced it, it impacts the person that's helping them cope with the distressing experience. And again, the more empathetic and open you are in your profession, in your personal life, the more likely it is that you will share or internalize that pain and devastation of the person impacted by the trauma. So oftentimes, if you're in a profession where you're helping behind the scenes of other people who have gone through these events, you might neglect your own exposure because all of the focus, again, is on the person who went directly through the trauma. The most common professions that are at risk for vicarious trauma are going to obviously be anybody in an emergency response medical field: doctors, surgeons, nurses, personal support workers, even the people who clean up post-surgery and the images that they're exposed to seeing, right? That's not a norm for them. They didn't go to medical school. They weren't seeing imagery that became something that they're familiar with as a result of operating every day. That person would never be considered under the umbrella of as being on the same level of exposed, right? But they can be. Counselors, therapists, and social workers. Again, we are verbally talking, hearing, listening, supporting people who have gone through some pretty significant trauma events over the course of their history. Then you have emergency responders, police, fire, any kind of rescue worker, EMS, dispatch. Dispatch is another good example. You know, they're not directly on scene to the trauma, but they're getting 911 calls of people in horrific events, in panic responses all day, back to back, constantly. So they would be another great example of not even being seen under the same umbrella as a police officer or a firefighter, but definitely just as much exposed to that level of workplace trauma. You know, and then you take correction officers, they're literally returning to the scene of workplace trauma on a daily basis with the doors locked behind them, right? So again, an experience of undermining safety for sure. And then, you know, if fairly new, we have things like CISM or critical incident response teams or, you know, psychological first aid teams that exist within organizations to provide support, which is great, but that can also be something that creates risk for vicarious trauma. And one of the things that can happen, whether it's personally or professionally, particularly professionally, depending on the job that you do, there are certain cultural norms that get embedded in that workplace as a norm that can make it very difficult to identify when somebody may have been impacted by vicarious trauma, as well as how normalized the level of stress gets. So if you're in a helping profession, you're used to operating in crisis all the time, you adapt to it. It eventually becomes normalized. And so you sort of become desensitized to feeling the distress because you can't really have an emotional reaction when you have to effectively do your job, right? A responder cannot pull up on scene where a child is injured and start crying and having an emotional reaction because then they can't effectively do what they do. And thank God for that, because it makes them very good and unique at their job. But a normal human response of emotion is meant to happen when the person feels pain. And so ultimately, you know, these issues become repressed. They become avoided. We can activate denial and not even recognize that we're negatively being affected. And that can ultimately lead to things like anxiety, clinical depression, post-traumatic stress disorder, and substance abuse issues. When these symptoms remain unaddressed, they will grow, they will change, they will progress, and they will eventually grow into an actual diagnosis that requires help. And as a society and as human beings, we have a tendency to be way more reactive than we are proactive, meaning we wait until we're already drowning to ask for the life raft, as opposed to recognizing that, okay, we're taking on water, we're a little bit overwhelmed here, we need help. We'll wait until we're in dire distress. And so this focus behind education here is, what do early warning signs and symptoms look like, specifically maybe for you? And how do you recognize when they're occurring so that you can intervene and prevent it from getting to a worse state? So talking about the way trauma impacts people and what kind of symptoms emerge, it's obviously going to impact people in a very different variety of ways. We often mistake trauma causing the more severe symptoms, flashbacks, nightmares, psychotic breaks, right? But there are way more subtle signs and symptoms that happen as a result of trauma that really get dismissed as no big deal or everyday issues, and sometimes even get misdiagnosed for a mental health disorder that isn't accurate, right? And so these subtle symptoms can look like mood instability, overreactivity to things, low sense of self-worth, severe anxiety, disruption in personality, stuff that you wouldn't necessarily connect to a traumatic event, especially if it's vicarious. And it can really lead to both psychological and physical changes. It can also cause us to keep reenacting the traumatic event without realizing it and constantly falling into patterns of self-sabotage and self-harm, even though we are committed not to. And there's really no way to predict what the trauma symptoms are going to be. Me and Kim and Bob might go through the same exact traumatic event, and Bob walks away fine, and Kim's a little bit distressed, but she moves on, and I'm having panic attacks and can't leave my house, right? There's no way to really predict it. You can get some sense based on the person's history, their background, their childhood experiences, their previous exposure to traumatic events. It really depends. But when we're talking about vicarious trauma, specifically professional vicarious trauma, symptoms are going to look like unwelcome thoughts of imagery. So, a cop sits down to have dinner and they can just get continuously flooded with thoughts of events that they went through that day. Or a therapist is sitting in bed trying to watch Dancing with the Stars and they can't stop ruminating on an event or an experience that happened with a patient that day. You can have more excessive things like nightmares and flashbacks. People will start missing work because they become burnout and they can't manage the level of distress that they're in. And social withdrawal becomes huge. People who are typically very engaging and outgoing become very isolated and shut down. People might start to avoid further disclosure from clients around traumatic events because they don't want to pile on to what they're already experiencing, which in turn is not the best for the client, right? Because then they can't openly talk about what they need to. This is inevitably going to lead to negative coping skills. When you don't get relief in healthy ways, you will inevitably revert into unhealthy strategies to get relief, because as human beings, we have to get relief or we don't survive. It can impact hyperarousal, like we talked about, and your sense of safety. You may avoid physical intimacy in relationships. People on the job become very pessimistic, very negative, and very toxic, right? So everything that's awful about work, they cannot pull themselves out of that. They lose motivation for the job, engagement on the job, disconnect spiritually, if you believe in that kind of thing. And eventually it impacts the entire workplace culture, and longevity is affected, and people create such intense stress that it can lead to medical problems or physical issues that never existed. Then you look at vicarious trauma from a personal level. There's some similarities, like avoidance of situations, places, and things. You may take the very long way home that's unnecessary because you don't want to go down a certain street or past a certain building that reminds you of a particularly difficult situation. You can have reenactment through bad dreams. You can have hypervigilant states as well, where you're just operating on such a high level of stress that you can't relax. There's a lot of fear around safety and never really feeling secure. Immense grief, anxiety, and sadness, right? So your normal emotional reactivity. Irritability is one of the most common symptoms because we typically will lose a lot of patience and tolerance as a result of being in that heightened stress, which causes us to be more reactive. And typically the people that are going to catch that first are the ones that are the closest to us. Then there can be kind of a morbid preoccupation. So, if you go through a traumatic event or your loved one does, let's say the parent of the teenager who was assaulted, they're now Googling, right? Going down a rabbit hole of any kind of internet access related to assault, victims of abuse, the impact of that, and just ruminating and constantly being exposed to more situations that remind them of the trauma itself. Then there can be a big sense of hopelessness and a decreased sense of purpose because, survivor's guilt. I wasn't able to fix it. I wasn't able to help enough. I wasn't able to change it for the person. And somehow we internalize that to be about our fault, right? This is on me. Even when we weren't the ones who directly caused it or went through it. And then, when you're not dealing with emotional distress, it will start to manifest physically, and people will experience things like chronic headaches, heartburn. They'll have stomach issues that never existed before, like GI conditions can start to develop, chronic pain, specifically in the back and the shoulders. And then we have trauma symptoms that are a little bit more psychological. So this is going to be things like fear, helplessness, change in attention and concentration are huge. People don't realize how much stress impacts us. When you stay in a chronic state of stress for too long, it will literally start to impair you. It impacts the way you process information, the way you retain information, your memories, your ability to output what you really want to say, and in turn, your reactivity. And that can really change a person's attitudes, behaviors, worldview. They can start to have a very difficult time functioning. They can go into denial of the fact that all of this is happening because our brains are pretty skilled and will turn off what we're not ready or willing to deal with. And therefore, we don't have the ability to even recognize what's happening with us. Then you're going to have your typical emotional responses like anger, depression, anxiety, guilt and shame, blame, which is going to lead to things like loss of interest and social withdrawal. Then there are physical symptoms of trauma, which are going to mimic that of like an anxiety disorder. When a person is in distress or triggered, they'll elevate in heart rate. That's one of the first things that happens. And then physiologically, there'll be a shift, shortness of breath, shakiness, right? Body aches and pains, tense muscles, because when you're anxious, you tend to tense up, feeling on edge or having a very, very heightened startle response. Things like nightmares, difficulty sleeping, which is going to lead to constant exhaustion, and loss of enjoyment being a very big one. We lose happiness and sense of joy. Then you have the more emotionally based symptoms that can occur, which looks like inability to cope with or regulate feelings. So this is like when you see a 20-year-old having a full-blown temper tantrum that of a 5-year-old would have, right? And logic you is like, what is happening here? But that person may be so developmentally impaired as a result of trauma exposure that they really don't have a skill set on board to tolerate any level of discomfort or emotion at all. So when it happens, because they have no tolerance for it, they react similarly to how a child would. And because of that, it leads them to attach to very poor coping skills. There becomes a very high need to self-medicate when you can't tolerate being in your body. It can also lead to very bad decision making, like who you choose to be in relationship with, typically unsafe, unhealthy, abusive people. People will start ignoring signs and symptoms of stress. Instead of saying red flag, something's going on, we just push it down, keep it going, and take on more, right? A very difficult time with trust. If you have been betrayed, let down, abandoned, hurt in some way, over and over, it's going to continue to create a belief that you can't trust anybody. And it keeps people very guarded, and they don't really have the ability to ask for help after that. Not only will they not ask for help, sometimes they can't notice the need for help. And that, of course, leads to a lot of low self-worth, self-esteem, a lot of questioning self, a lot of self-blame happens as a result of trauma. It's hard for a lot of us to make sense of the fact that another human being, especially if it's a family member or a caregiver, is capable of hurting us like that. And as a result, instead of putting accountability on them, because we can't accept it, we will internalize blame and start to feel like something's wrong with me or bad about me that this is occurring, or I did something wrong, so therefore I deserve it. And all of the negative emotions become internalized, and it gets really difficult to get themselves out of. And then these reenactment patterns occur. So the example that I use here is, let's just say you grow up and you're super attached to your dad. He's your hero, your safe person, you adore him. And at some point he leaves. And then a couple years later, your mom heals, gets in a new relationship. You get very attached to this gentleman. He's your hero, your love, safety, belonging need gets met, and he leaves. And then you grow up and get in your first relationship. And guess what? He leaves. At some point, there's going to be an imprint, a template, a cognitive shift in belief that people always leave, because that's been the experience since you're 5 years old. And then you get in your first healthy relationship and the person doesn't go anywhere. That is not going to feel comfortable for that person, because it doesn't match what the story their head is telling them is going to happen. My belief says you're going to leave me, but you're not leaving me. So we will subconsciously sabotage. I love you. I hate you. I want you. I don't. Get away from me. Please come back, until the person can't take it anymore and they leave. And then we're like, see, everybody always leaves me. When in fact, we created that outcome, not consciously, not intentionally. But when we don't deal with underlying unresolved issues, they will continue to drive patterns that are harmful for us. There's also a lot of negative mistaken beliefs about trauma because of historic practices being very old school and a lot of the changes that have happened over the course of time. So one of those beliefs I think I mentioned earlier is that trauma has to be something that was life-threatening, like a car accident or a kidnapping, very extreme situations. We know now that that's not the case, right? It's anything that creates a negative response or is outside the scope of a normal experience. Everyone who has been through trauma has PTSD, right? Or is affected. Not true. Some people have a level of resiliency and coping skills onboarded that they're able to process it effectively and move on and never be impacted, right? Other people don't, and that doesn't measure strength or willingness or any of that. If someone else went through a worse event than I did, I shouldn't consider my situation traumatic. Again, our tendency is to really downplay, compare, contrast, look at everybody else's pain and find reasons to think why ours isn't valid, right? But it's valid because it's yours and it's your experience and your feelings. And if it's negative, it's real and it's okay to acknowledge that. The other one is that vulnerability equals weakness, whether this is professional in that I don't want to be judged. I don't want to tell my boss that I'm negatively affected by something and then be seen through a lens of somebody who cannot do the job, right? Who isn't capable, who isn't effective. Then on a personal level, it's like, I don't want to be judged. I don't want to be shamed. I don't want people's worldview of me to shift. I don't want self-pity. Whether you're taught from a very early age or you learn it later in life, the idea of we don't show how we feel externally. Suck it up and deal with it, keep moving. And we are very skilled at presenting as if everything is fantastic when it is a complete mess internally and at home. And we become very good at it to the point where people would have no idea the level of suffering that we may be in. And that's why when someone completes suicide, you'll hear people say, I didn't even know that they were depressed. I had no idea they were even upset. Because you wouldn't unless they chose to tell you that, right? Another big one that aligns with this is this idea of I can handle it on my own. From a early age, our parents send us messages, whether it's directly or indirectly sometimes, because that's what they learned, that you just deal with it, right? And that creates a lot of beliefs like I should be able to handle it by myself. And if I can't, something must be wrong with me. Or this idea that it'll eventually go away, right? And sometimes it does, but sometimes it doesn't. And when it doesn't go away, we shouldn't assume that at some point it's just going to disappear. We should acknowledge it, intervene on it, and address it. Another good one to mention is I have to share honestly every detail of what happened to me in order to get better. This is actually the complete opposite of what we encourage in trauma therapy. So we do not want to repeat or relive the graphic details or the story of what happened to a person. All that does is re-trigger and re-traumatize them. What we have to focus more on is how to reprocess the memory or the event where it's stuck so that we can remove the trigger response that occurs for the person when they think about it, when they talk about it, when they relive it. And look more at how is this past event affecting you today? Where is it interfering? Where is it disrupting functioning? That's more of the focus, less about the graphic, gory details of what occurred. And finally, this idea that this is never going to go away. The good news is trauma is incredibly treatable. You can do it sometimes in very little short periods of time and live the rest of your life in a very happy, positive way. That's the good news. But innately, as humans, as I kind of talked about, we do not like pain, whether it's physical, mental, emotional, we don't like it. And we will avoid it, duck and dodge it, get over and around it any way we can. And we're very creative in the way that we do that, right? This is called survival. A lot of us don't want to feel it. We don't want to address it. We don't even want to acknowledge it, right? The more we do that, the more we're fearful of the impact that's going to occur and that we're going to turn into a puddle and never get out of it, right? As a result of that, when we are in a heightened level of pain, we can typically go into denial of it, which really helps us avoid how bad the impact is and causes our stress to elevate even higher. And then we stay in a chronic state of stress for even longer. And as a result of that, we tend to use a lot of our primary defense mechanisms to get through the day-to-day. And these are the primary ones that we fall into. The first one is compliance, which is I'm going to feed everybody what they want to hear and present perfectly on the surface so that nobody knows I'm suffering. The second one is aggression, which is anytime somebody gets close to figuring out that I'm not okay, I'm going to snap so that it basically sends them a message never to go near that again, right? If we try to address someone we love on something they're doing wrong and they blow up and get extremely defensive, oftentimes we'll shut down and we won't ever do it again, right? It sends a message. Then there's flight, which is running away. If I just get out of Dodge, run away, avoid what's happening, I don't have to feel it, right? Freezing and numbing are more of a depression response where people just lose the ability to even feel what's happening. They become completely numb to the emotional distress. Dissociation is more of a high-level trauma response if it's somebody who has PTSD or has been through a lot of trauma over the course of time. Dissociation is sort of where your brain and body does for you what you can't do for yourself and just detaches, disconnects physiologically because you can't tolerate what's happening. And then compartmentalizing is, I can't tolerate the whole event. I can't tolerate everything that's happening, but I can tolerate this small portion of it. So I'm going to make that my reality and block everything else out. Or I'm going to associate the trauma with something that makes it more tolerable. Like, a first responder sees someone who had a substance abuse issue, overdosed and died, right? Well, they did drugs, so they died. That makes sense to them. And really, that's not a fair association, but it helps them tolerate seeing that on a regular basis a little bit more than if they have to look at them more as a human being, which activates more pain and empathy. In addition to all of this, we have a lot of fear around looking weak or being judged in some way, especially by people that know us. So we won't admit our need for help and we'll act as if everything is okay, even when it's not, right? And it's funny because a lot of us, if someone you love is coming to you and saying, I'm really struggling, you're not like, wow, you're really weak, right? You don't have that reaction. You're compassionate, you're caring, you're vulnerable, you help them. And people would invite the same thing if you were in distress, right? But our brain, our belief system is what gets in the way of that. The problem with this is avoidance, denial, defense mechanisms, they work until they don't, right? And eventually it's like a pressure cooker, right? It's like it's going to blow at some point. Eventually, your usual tricks of not dealing with what's going on aren't going to work and it's going to spill over. And this is where the negative impact is really going to hit. And people will start to lose their ability to function normally at high levels the way they once did. Bad decision making kicks in here, poor judgment kicks in here, desperation. And that leads to a lot of maladaptive or what, that's clinical language, but like compulsive, impulsive, problematic behavior, and the need to self-medicate. So people here start to rely a little more on substances, alcohol, and bad behavior to get out of themselves because they don't want to be in their own skin. So they need to do something for instant gratification and relief. This is where things typically progress into more of a mental health diagnosis, like depression or adjustment disorder. This is where you're going to start to see the really big impact of that. So the best way that I teach people about this is looking at the way we're wired to respond to stress. Okay, so up here, this is the the frontal lobe. This is where all of our logic, reasoning, rational decision making is. This is important. It's what keeps us sane, right? That's up here. Then back here, you have your amygdala. That is where all of your survival skills, your instincts, your defense mechanisms are. When those two parts of the brain are connected and online at the same time, we are moderated in stress. We are safe. We are in our window of tolerance. We're able to regulate our emotion. We're high functioning because we're making decisions with both logic and emotion. What happens when we start to elevate in stress and it becomes unmanageable or overwhelming, and our brain starts to experience it as a threat? The frontal lobe, the logic, the reasoning, turns off, and automatically the amygdala, instincts, survival skills, defense mechanisms, becomes the driving force. So logic turns off, emotion becomes the driver. We have no conscious control when this happens. So it's kind of like when you're watching the scary movie and you're like, this chick just ran up the front steps right by the front door, right? And it's so stupid. But really, if you think about it from this context, that girl doesn't have any logic. If she did, she'd be like, oh, my keys are there. There's a window. There's a front. She'd plan it all out and be dead by then. She just knows there's a threat. Someone's trying to hurt me. I need to run. There is no logic behind it. And it's the same thing whether someone's pointing a weapon at you or a therapist is poking at you to talk about core issues you don't want to address. The brain doesn't know the difference. It only knows this feels threatening to me. I don't like it. I don't want to deal with it. I can't tolerate it. Let me do what I know how to do to survive, which is those primary defense mechanisms. They're going to kick in and they're going to be the way that we continue to avoid and deflect. This coupled with the fact that once we go through a traumatic event, it shifts our baseline for stress, and things that were once abnormal become very normal. So we all have a baseline for stress. Let's just say mine is here. When I feel stress, I go up, I come back down. Every time you go through a high stress trauma event, your baseline elevates. So then when you feel stress, you go up even higher, right? And then come back down. So the level of stress somebody with trauma feels is enough to put your average person close to a psych unit, right? It's such a high level of distress and dysfunction and crisis all the time. And when you're not processing what happened effectively, you won't be able to manage your emotions in a normal way. You'll hit that point of hypervigilance and live in a constant state of fear and paranoia. And when the trauma is not processed effectively, post-traumatic stress disorder can occur. So again, it's very normal to experience some fear, sadness, discomfort after trauma. If you didn't, I'd be worried about you, right? Most people will process it, they'll move on, they'll be okay. But when the trauma from the past continues to impact you today at the same level, it's more aligned with post-traumatic stress disorder because there is a physiological, biological, somatic response. So remember, the firefighter, right? That trauma was not happening right then and there, but he reacted as if it was because that's what his brain and his body told him. That's why with PTSD, people will have severe nightmares, or, veterans will wake up with a weapon in their hand, not knowing how it got there. There's constant heightened levels of reenactment because the threat is present at all times when they are triggered. And this very much requires treatment, but it is very treatable. Again, very, very, very treatable. There is certain criteria that we use to diagnose PTSD, and this is what that criteria looks like. So first, we're looking at what was the actual trauma? Was it something the person went through directly, or did they witness it? The second criteria is the re-experiencing of the trauma. How is it showing back up in your life? Are there intrusive thoughts? Are there flashbacks? Are there nightmares? Are there constant triggers? Then we're looking at, does this traumatic event cause you to avoid stimulus that could remind you of the trauma? So again, taking the long way home, shutting the curtains and the doors on an anniversary that reminds you of something negative, shutting out the world, things like that. 4 is, has it created a shift, a negative shift in your thinking and in your mood? So has your perception and beliefs changed? Just like we talked about, the world is not safe. People are not safe. And then finally, we're looking at the physiological response, the impact. Is there hyperarousal, hypervigilance, heightened stress, and reactivity as a result of what the person went through? Are they having mood swings they're not in control of, or are they hyperactive? There's a really great tool that you can Google if you're interested in learning a little bit more about where you stand. It's called the PCL5 or the PTSD checklist. You can Google this and find it online for free, but it's basically an assessment that asks you a bunch of questions where you're going to get a numbered score at the end. And it's all the questions are based on the criteria that I just went over to show you where you fall on the trauma scale. And if you score 31 to 33 or higher, it suggests that you probably have symptoms of post-traumatic stress disorder and that you most likely need some form of therapy or treatment to help support it. And it's pretty amazing when you take it because a lot of people think they're not as affected as they are. they don't realize the symptoms of trauma are so minimal or subtle. And when they take it and realize how high they are, it can really break a lot of denial and show, okay, I'm impacted more than I realized, which means I need help. Um, this is something, the iceberg model of behavior, that I always mention when I'm talking about trauma, because whether you're in the field or not, you're a layperson, it's personal, it's professional. The way a person presents to you doesn't always match what's happening internally, right? And so when you see an iceberg, you're seeing 10% of it on the surface of the water. 90% of it is underneath, what you can't see, what you don't know, what you're not in tune to, what you have no idea is there. So what we see happening on a surface level might be difficult, right? You're aggressive, you're moody, you're reactive, right? You're focused on all the unhealthy responses the person is presenting with. As a result, it can be very hard to feel any sense of compassion or empathy for that person. You can really become extremely frustrated by the behaviors or the symptoms. And if you get a sense of what drives that for the person, it can really shift your perception in a big way. So a behavior that once seemed extremely problematic and, blatantly disrespectful can actually be shifted when you're looking at it more as a wired automatic response that came from a traumatic event, right? So let's say we have a patient in treatment who suddenly punches the wall and becomes aggressive, right? On a surface level, I'm going to be like, whoa, that's a massive reaction, unnecessary. What are you doing? Problem behavior, problem kid, whatever it is labeled, right? Then you sit down and talk to the person and they tell you that they were sexually assaulted from ages 3 to 8 and that another patient came up and touched them on the back in a way that triggered them, right? It changes your whole perception of what happened, of the behavior, of the way they reacted, and increases the compassion you would feel towards that person, because now they weren't just blatantly or intentionally trying to cause harm. They were triggered in their reaction, right? And warranted. Doesn't excuse or justify the behavior, but it just helps make sense of it so that we can see a person through the lens less on how they present to us and more about the whole person, what they come with, what their history is, what they may have lived through. One of the more defining ways that trauma impacts people is by disrupting personality. And it creates very maladaptive, or again, problematic personality characteristics that are extremely hard to be in relationship with, or actual personality disorders. So this would include things like defensiveness, severe ego, narcissism, excessive control, manipulation, things that you would necessarily be like, I can't, I have to leave this relationship, right? They're normally the result of some very deep-rooted needs not getting met in early childhood as a result of abuse, neglect, abandonment. So I'll give you an example. I specifically have been a clinician for 15 years, but I get very triggered by narcissists. I have a very hard time not wanting to get in arguments with them, right? All that really does is fuel their symptoms, right? And it's normal as a human being to be reactive to that level of, you're smaller than me, putting you down, manipulation. Of course, you're going to have a reaction. But for me, I try to widen the lens of why this person is that way. Why do they present that way? They may have suffered severe abuse and neglect to the point where they're so overpowered by shame. That is the only way they know how to be in relationship with people. We are all born with the need for safety, love, trust, and belonging. We need those needs to get met the same way we need air, food, and water to survive. When our emotional needs do not get met, we start to become hardwired on how we can meet them ourselves. And it's usually unhealthy and unique and creative because we're kids, right? But it's survival. And so these types of experiences will leave major imprints and start to impact development and start to impact personality, the way the person copes, the way they see themselves, and cause them to inevitably revert into a lot of unhealthy strategies. It's all they know how to do, right? So I'll give you some examples. Oh, what did I just do? Sorry, I'm trying to move this over so I can see the slide. So this would be an example of unmet needs and the impact that that has, right? Which is, okay, these needs didn't get met in childhood. So how do I overcompensate for that in my adult life? So you may see somebody who's very controlling and manipulative, right? And you may say immediately, this is a deviant person. But let's trace that back a little further. Let's say that person, was abused on a nightly basis by their parent, right? They didn't know what was going to happen until they walked in the front door and saw what kind of mood dad was in. If he was drunk, am I going to get hit? Constantly living in a state of fear and lack of safety. As an adult, controlling the way everything is, how it happens, when it happens, other people in your life, manipulating circumstances, may be the only way that person knows how to feel safe because they never got that need met when they were supposed to, right? So now I can take a deep breath if I can control everything around me. Similar to feeling superior or ego when someone's like, I'm more important than you. You need to recognize who I am and the accomplishments I come with, all driven by excessive shame, right? Not getting validation as a kid, not being recognized or, acknowledged for the things that you accomplished will lead people to constantly compete, be in perfectionism, always wanting to be the best. That's the only way I know how to validate that I'm worthy. They might act out behaviorally, substance use disorder, sex and love issues, right? Anger and aggression. Or they may go more internal and have issues with low self-worth and difficulty with self-love. A lot of it really drives an excessive need to meet whatever didn't happen as a kid when it was supposed to. And that leads to these decisions and maladaptive attempts to kind of get yourself in a place where you can feel that love, safety, trust, and belonging, even if it's harmful, even if it hurts you. Like, why do people stay in this abusive relationship? I don't understand, right? We see that all the time. For some people who have been constantly neglected, abused, harmed, really don't believe that they're worthy and lovable, they would rather stay stuck in something abusive and harmful than be alone because they have no tolerance for being alone. And they may really believe that this is what they're worthy of. So they tolerate it and they don't have a different line in terms of how they're expected to be treated by somebody. There is always underlying factors, underlying drivers to the reason that things are happening the way they're happening. So that brings us into a point around generational trauma, which I saw someone had a question about. But early imprints, these templates that get formed from early childhood, they happen as a result of our exposure to things. What kind of relationship dynamics did we see as normal? What kind of relationship patterns did we see? How were we treated by our caregivers? How were those needs met? How were we taught to feel about ourselves? How are we taught to think about ourselves? How are we taught to think about other people? We're not born into the world like no one can be trusted and this isn't a safe place, right? That happens over the course of time because of our experiences. And those impacts have a lot to do with the way in which we are wired and lead to reenactment in every area of our lives, right? If it remains unaddressed, it will continue to spill over, whether it's consciously or unconsciously, to our immediate family and our relationships. And when we don't address those underlying core issues, right, it creates more risk that we're just going to repeat the patterns. We repeat what we don't repair, and we become comfortable with what we know, even if it's problematic. So, for example, a lot of people within this generation were taught, you don't talk about what happens in the home outside of the home. You don't tell people outside of this house what's going on, right? Which sends a very scary message that you have to keep everything buttoned up and really walk outside and keep your head held high no matter what's going on. That may be a norm. That may be the way that you're wired and all you knew growing up that then spills over into how you teach your kids, right? Or you may have had a very unhealthy marriage dynamic because of the reasons we just talked about, not intentionally, right? That then the kids see that they think is normal. And you can go one extreme to the other. You can repeat that pattern, or you can go in the complete opposite direction, which happens with substance use disorder as well. But there are a lot of connections between vicarious trauma and behavioral health issues. So you're going to see when you have untreated vicarious trauma, more risk factors for mental health, more risk factors for substance abuse, more risk factors for family and marital discord, relationship issues, post-traumatic stress, reenactment, and compassion fatigue and burnout, which we're going to talk more about. So let's look at the mental health component. If you are a helper or an empathetic person or a compassionate person or somebody who's in tune with somebody else's emotional issues or pain or suffering, it's going to lead to a lot of anxiety, anger, and difficulty that can create mental health diagnoses, right? Especially paranoia and fear. So these experiences lead to that heightened stress, which can create anxiety disorders, depression disorders, and personality and mood disorders. Just to give you a sense of how we define mental health, right? It's really a person's overall emotional and physical condition or psychological condition. But when a person is unable to use their cognitive and emotional capabilities to function in a normal, healthy way and meet the everyday demands of life, that's when the diagnosis or the mental health symptoms now require help, right? Because all of us are going to experience various symptoms of anxiety and depression. When is it a problem? It's a problem when you can't function the way that you once did or the way that you really want to. So just to give you an idea of current stats post-pandemic, it's pretty alarming. 1 in 5 US adults experience a mental health illness each year. 1 in 25 experience a serious mental health event annually, meaning things like a psychotic break or something severely acute that requires severe help. 1 in 6 youth, which when we're talking about youth, we're looking at ages 6 to 17, experience a mental health disorder. Then you have 75% of the mental health diagnoses occurring by the age of 24. Suicide is the second leading cause of death for individuals age 10 to 34. We now currently live in a society where people would rather take their life than ask for help, right? And how did this get created? The number of residents in our own community, which is specific to Delaware County, with a mental illness is 375,000 or 1 in 4. Post-pandemic, it got pretty bad, right? And the pandemic really created avenues for vicarious trauma and historic trauma to resurface. The isolation fueled a lot of trauma symptoms for people. And again, as human beings, you're going to experience stress as a result of things like that, or job changes, or being terminated, or relationships, or medical things that came out of nowhere, living your whole life normal and then bam, getting hit with a chronic illness. Or, trying to manage or take on way too much, all the day-to-day responsibilities. The most common diagnoses you're going to see as a result of untreated trauma are going to be your depression disorders, which are characterized by low motivation and drive. So things like getting a shower, basic self-care become incredibly difficult to do. Anxiety disorders are, characterized by heightened levels of excessive stress. Constant fear, constant paranoia. That's typically irrational. Then you have your mood disorders, which is exactly as it sounds. You're bouncing from one extreme to the other. A lot of mood instability. You go from depression to overexcitement and mania. Personality disorders, which we talked about. Trauma disorders. Phobias, which happen as a result of anxiety disorders going untreated, which is based on very irrational beliefs. So if I don't flick this light switch 10 times, the world's going to blow up, right? It's a complete irrational thought, but it's real for me. So I have to do the behavior in order to feel relief. Then you have your greater psychotic disorders like schizophrenia that really require a higher level of help. In addition to mental health, trauma can very much impact substance use outcomes. So anybody who has suffered a history of trauma and or current trauma experiences immediately becomes at higher risk for substance abuse and self-medicating. The stats that I found say 59% of people with PTSD also have substance use disorder. I believe that number to be much higher than what it is because a lot of people are not going to honestly share their, open situation and, research like that. I want to be careful about the message that I send here because I do not believe, and research indicates that trauma does not cause substance use disorder. Trauma disrupts personality, coping skills, reactions, stress responses, the inability to tolerate the discomfort that you're in, which is what creates increased risk for problem behavior, such as substance use disorder. So there's definitely an inevitable correlation, but I am careful to say that the reason you're an addict was because of your childhood, because that's not necessarily the case. It's not always measured that way, and it can put a story in people's heads that allows them to justify staying sick, right? It's kind of like if you had my mom, you'd get drunk too, right? And they stay in that belief system for a very long time. So severe discomfort breeds the desire for avoidance. As I said, we just don't want to feel pain. I looked into some specific substance research to look at whether or not there's any, highlighted correlation with the trauma. There's not much research out there on that, but what it did show is that these are the primary substances people with trauma gravitate towards. So you have your opiates, which is most likely because opiates are the most incredibly numbing substance on the planet, which would really help somebody who doesn't want to be in their body because they're in immense distress, right? I want to avoid, I want to numb, I want to escape. Opiates help with that. Methamphetamine, which is a stimulant, is so easily accessible and such a low cost that people are gravitating more to that drug. This drug is making a major comeback right now. And it leads to a total disconnect of reality, right? Just complete heightened sense of mania that allows you to not really look at what's going on. Then you have alcohol, which is more socially acceptable and legal and easily available for people. So it becomes a norm to just go home from work and self-medicate, drink until you pass out, because that's the only way you can tolerate everything that just happened in the day, right? That's supposed to say street drugs, not stress drugs, but I guess it could still make sense. Street drugs like kratom and other substances that are kind of the gas station trends that are currently happening are making it way easier for younger kids to access substances, which is really bad because the younger generation is already wired for instant gratification and relief as a result of getting everything. Everything comes very easily and very quickly. Like, remember when you couldn't remember a song and you just had to wait till it came to you, right? There was no Google, there was no ability to research it. We didn't have that. So we developed a sense of tolerance for waiting. We had more patience. We had more ability to deal with discomfort. Now, anything you want, you can get, and you can get it right now, which removes some of that tolerance. And it is creating a new wave of generation where when they hit severe discomfort, they have no idea what to do. So innately, they go right into what's going to distract me from this. Just like with marijuana, right? There are so many forms of THC and different marijuana edibles, liquid forms, and it's legalized. People can go with anxiety disorders, with trauma disorders, and self-medicate for that. So there is something I like to get across in these trainings, even though it's more trauma focused. When you're learning about substance use disorder, for those of you who may be impacted by it, it's really important to understand it as a disease or a diagnosis. A lot of people have a hard time with this because they think that we're somehow excusing or justifying the person's behavior. We're not. They still have to be accountable. They still have to be responsible to treat it and make amends. But we do want to help people understand that there's a difference between who someone is and what happens when they get sick. Substance abuse is recognized as a disorder under the American Medical Association because it creates this mental preoccupation and obsession that drives the compulsive behavior despite consequences. So what does that mean? An alcoholic gets a DUI and the first thing they want to do is go home and drink, right? An addict just died and got Narcaned back to life from an overdose, and the first thing that they want to do is go get high. The consequences alone do not produce enough to make a change in the behavior because the disorder has impacted their biology, their brain chemistry, their perceptions, their beliefs, their thought processes, their behaviors. I could go on and on and on. So, there is certain criteria that separates someone who is abusing and misusing to someone who is dependent. Abuse is like you're using or misusing the substance a little more frequently than what it was intended and starting to have some minor consequences as a result, which happens a lot with self-medicating for trauma, right? I'm binge drinking and maybe my spouse is getting angry at me and threatening divorce, or maybe I'm missing work more frequently, but there's no life-altering consequence there. But the dependency is more about physically, I am wired to be dependent on this substance. And if I don't have it, I will get severely ill. As a result of my tolerance, I've now increased in how much I'm using, how frequently I'm using, and how I'm ingesting. And you have seen a shift in my personality. I am now withdrawn. There's family dysfunction. And I've made several attempts to stop, cut down, and control what I'm doing that have been unsuccessful. In addition to substance abuse and mental health, vicarious trauma can also create family discord, right? Vicarious trauma and other forms of trauma can really cause subtle signs and symptoms that they don't always get recognized as trauma. So you'll see the mood instability, the reactivity, the aggression. And when people can't connect one to the other, communication gets affected first, and people shut down and they stop talking to the people that they love and allowing their support in and being honest with them about what's going on. So then the behavior, the way the person's presenting, doesn't match what they're saying. Because you might be like, I'm fine, clearly you're not, because everything about the way you're reacting would suggest otherwise. But family doesn't know how to address this oftentimes. They don't know what to do. It's traumatic in and of itself to watch someone you love suffer from a diagnosis that you're absolutely powerless to do anything about, right? That in and of itself is traumatic. So in order to survive that, people in direct relationship with the person who is traumatized or suffering, they revert into their own unhealthy roles to survive, like codependency or control or these trigger responses. And if the vicarious trauma is caused by direct personal or family relationships, inevitably that's going to create discord and emotional distress, right? The one who's experiencing the trauma directly is going to struggle with their own discomfort, but the people that love them are going to experience the impact of that indirectly because they're connected, because they care, because they love them. But their tendency, again, is to be like, this didn't happen to me. Or they become obsessed and preoccupied with the person it did happen to and avoid the impact on themselves. So these symptoms start to spill over. They start to mirror one another, especially if there are pre-existing issues from the past. And this is how vicarious trauma really starts to impact the family system. Another thing that it impacts is something called compassion fatigue, which is more common in the professional realm. But this is also known as secondhand shock or secondary stress reactions, where this is going to describe a level or type of stress that comes from helping or wanting to help someone that is traumatized or under significant emotional duress, right? So this is a little different than burnout. Compassion fatigue is very treatable and a little less predictable, but the onset, is very sudden, whereas burnout happens over the course of time. In addition, most of the time, if someone hits the point of burnout, they have to completely leave the situation, the job, the relationship in order to get better. It's that severe. But with compassion fatigue, it's more manageable. There's more opportunity to pay attention to what's happening and get help. Symptoms of compassion fatigue. So pay attention if you're somebody, even if you're not in the helping profession, but you are a helper or a nurturer or a caregiver in nature, or you have a sick loved one or family member that you're constantly paying attention to and caring for, these are the symptoms that come from compassion fatigue. Chronic physical, emotional exhaustion. And I mean exhaustion. Depersonalization is like, I'm no longer going to associate what's happening as an emotional, real experience. I'm just going to detach from it completely because that's the only way I can tolerate it at this point. Feelings of inequity towards the caregiver relationship, right? So you can create a resentment against the person because so much of your life is preoccupied around them, which can cause a lot of irritability and low tolerance for what they're doing and how they're doing it. Lots of feelings of self-contempt, and this is going to disrupt your physical life routines, difficulty sleeping, weight loss or weight gain, headaches, poor satisfaction of overall job or life, right? People stop caring. They become disengaged. They lose their motivation and joy to participate in helping that person because it becomes so exhausting. Compassion and empathy are a wonderful quality to have. We don't want to take that away from people. But when you give, and there's nothing left for you, you are inevitably going to be affected, right? Some ways that you can manage compassion fatigue. Number one is practice self-awareness and self-monitoring. Has this hit a level where it's changed your behavior, your work, your life outcomes, right? Your ability to function? The first step is really looking at, okay, where am I affected and what can I do about that? Is there an area that I can't do anything about it? And let's look at balance here, right? Because sometimes it's like, well, I can't do anything about it. It's my life. Okay. Well, then let's look at how you're affected by the compassion fatigue and where you can make changes in your own life. We can't control what's going to happen, but we can control our reaction to it. So maybe we reduce our interactions, we reduce our time frames, we reduce our our stressful workloads, minimize what the experience is causing. Monitor your sleep patterns. I know it sounds so cliche, but you have to get regular rest. Things like taking regular vacations for yourself. That goes out the window when you're taking care of somebody else constantly, especially if substance use disorder or trauma is involved. You'll feel like, I can't go anywhere. God forbid something happens to them, right? Self-care is really individual to the person. Like, don't be like, yay, I'm going to meditate for 45 minutes if you hate meditation, right? You want to do things that work for you, that you like. I don't like meditation. As you can tell, I'm a talker and I don't know how to slow my mind down, right? I don't like it. It makes me feel more uncomfortable, but I do like physical walking. That makes me feel moderated. So journaling, meditation might not be for you, but find what does work for you. Where is your joy? Your hobbies, your interests? What do you need to get back to remind yourself of who you are at your core? And I'm always going to say this, therapy never hurt anybody, right? It never hurts to have somebody who's disconnected from your family, your emotional situation, give you guidance, give you support. Just to validate what's going on is really helpful. Then you have burnout, which is also a result of not addressing vicarious trauma. This is more of a syndrome that's conceptualized as a result of chronic workplace stress that has not been successfully managed. It can also fall under the category of being a caregiver or a helper. And it's characterized by a couple things: feelings of energy depletion and exhaustion, increased mental distance from that person, from your job, and constant negativity. I mean, cynical, pessimistic focus on everything that's awful, no ability to see any kind of positive, reduced professional efficacy. People don't care. They don't care anymore. They start to self-destruct. It's important to know that burnout is a phenomenon that's specifically related to the level of care and helping that you're offering, whether it's personal or professional. So that's important to note. If there are other factors, divorce, relationship discord, it's not burnout. Burnout is specifically related to that. So some of the other symptoms, like we said, physical, mental exhaustion, sense of dread, right? So whether you're driving home and you don't want to walk in the front door, you're just dreading being around that person because you have nothing left to give, or you don't want to get out of the car and go into work, right? The anger, the irritability, reduced productivity. Again, no motivation and drive to really want to strive and accomplish things throughout the day. Becoming hopeless and helpless is a really negative place to be here. It's very hard to get out of it once you're stuck in that place. People become resentful and it shifts the entire culture of the relationship norms, whether it's at work or at home. And that's going to start to spill over into every area of your life and create some mood instability, which causes some really bad reactions for people. They stop being able to manage their emotions appropriately. So you might see a nurse or a cop refuse to get honest and get help because they don't want to hurt their job, right? They don't want to be seen as somebody who can't do the job because they're effective. So they hold it in, swallow it up, they keep pushing forward. And then it gets worse over the course of time. It starts impairing them. They start making bad decisions and they do something they can't come back from, right? If a responder who has a split second to make a decision on their life or somebody else's makes a bad one that ends fatally or makes the wrong one, no one is thinking about the responder after that, right? They're like, you're done. Your career's over. Here's your consequence. You're out. Nobody's looking at what happened, right? Did they have some stuff going on? Was there something we missed? Were we not treating what was happening? Like all these things have to be considered in terms of the long-term impact they're going to have on us. There are some ways to address burnout, right? It's more difficult because it's a more severe place to get to. But number one, you need to find the source. What's causing this? What specifically is causing me to lose all interest and passion and investment? And where can I make immediate changes for this, right? I'm going to start setting boundaries. I'm going to start saying no. I'm going to start making time for myself. Talking to people you trust is huge. There is so much power in connected relatability from somebody else who understands exactly what you're going through, right? Take back control, delegate where you can, prioritize, leave on time, do what you need to do for your self-care first, right? Practice self-compassion, grace and mercy for us. Where is the room for us to not be okay, right? Paying attention to your own needs and then meeting those needs in a healthy way. I'm tired, so I'm not going to do it today. I'm going to go take a nap, right? And again, I say this all the time, remember your joy. Like, what makes you happy? Has that been so depleted that you haven't even thought about it over the course of time? Ways to specifically look at addressing vicarious trauma, right? Sorry, something just popped up. When we feel all the things associated with vicarious trauma, we need to release that negative energy, that heightened stress, that hypervigilance from our body and our mind. So some form of physical activity, whatever that looks like for you, running, swimming, yoga, anything, shakes out the adrenaline impact that happens when you're in a heightened state of stress. If you're more creative, things like art, music, writing have all been shown to help with the intensity of vicarious trauma. Those are what we call coping intervention strategies, meaning I'm in a trigger place. What do I do to bring myself back down? This is prevention strategies. What do I do every day to help minimize the risk that I get to a bad place? And it's important to really examine, is there anywhere in your life that you are the cause of, bringing this trauma back in? Am I recycling? Am I reorienting? Am I preoccupying or focusing on things that are just fueling my symptoms, right? We need to be aware of social media. Like, it used to be that you had a choice to watch the news, see the graphic images that were shown. Now you might just be scrolling and up pops a school shooting or something you didn't ask to see, right? And it's constant exposure and it's constant reminders. And if you have pre-existing issues that are triggered by that, you may not realize it, but you're keeping yourself in a heightened state on a daily basis. So this kind of reorienting or re-experiencing really impacts somebody's health and well-being. It causes a lot of rumination. Like, I used to go home from work and watch intervention and substance abuse documentaries. It was like, my God, you do it 8 hours a day and now you're just watching it on your personal time. What are you doing? It's like, take a break. Like, it just becomes so much of what you're preoccupied with. And it causes people to go into severe coping skills and defense mechanisms, and they become very focused on the doom and gloom of the world and their life. So the focus is really always on distinguishing things that are healthy for you and unhealthy for you, and building your competence and ability to selectively choose what should happen in your life on a daily basis where you can control it. Support networks, I cannot preach enough of. Trauma heals in a lot of ways. Therapy is huge, but one of the non-clinical ways that trauma can heal is through support networks and support groups. Shared lived experiences that are relatable and connected to what you are going through creates power. It helps build resiliency. It brings immense relief to know that you are not alone. It's normal what you're going through. I'm going through it too. There's hope for it to get better. That needs to become the focus. And it has to get normalized. I highly suggest this for anybody that's struggling with a family member with substance abuse, mental health, or grief and loss. And obviously, if you're someone who's professionally vicariously traumatized. The best forms of therapy for treating vicarious trauma, the first one that I'm the biggest fan of is EMDR, which stands for eye movement desensitization reprocessing. Whoever came up with that name, it's a doozy. But basically, it is a psychotherapeutic intervention that is widely used for people who suffer from trauma. And as I mentioned, where the trauma gets stuck and the person becomes triggered and the logic turns off and they start responding physiologically in that threat, what EMDR does is it keeps the brain's logic on board and online while we pull up the trauma or memory and desensitize the person to the intensity of the feelings, the thoughts, the reactions, the emotions that are associated with that event, so that the memory is never gone, but the trigger response is removed forever. It is a very amazing modality that I have done personally that I can say works very effectively. If you're someone that has that physiological response when you're triggered, this is the best place to go. Then you have cognitive behavioral therapy, which is really about, let's look at how you think. Let's look at where this comes from. Let's look at how irrational thoughts create challenging behaviors, right? It's very focused on talk therapy. Dialectical behavioral therapy, or DBT, uses concepts centered around mindfulness and acceptance. So how can I, instead of trying to change what I can't change, how can I accept my current situation and just be more attentive to my own needs and the emotional impact? And then where can I bring in this modality? Actually teaches people skills and intervention strategies that are really healthy and help reduce self-destructive tendencies and control really intense emotions. It's also a really effective approach. Schema therapy allows people to break the repeated cycles that happen as a result of these embedded templates, right? Why do I keep picking the same guy, different face, right? Why do I keep ending up marrying someone that's just like the person I didn't want to marry? Why do I keep getting in cycles of abusive relationships? Why can't I say no to my kid, right? These are repeated patterns that are causing harm in your life that you might need help to change. We may be motivated to change it, committed to change it, and really make an effort to change it and be unsuccessful because it is just part of how we're wired to react. And we really need help with that. Again, empathy is a very valuable trait. And if you are a helper personally or a helper professionally, I commend you and really encourage you to continue to do that if it's where your passion is, right? We want to have a compassionate approach to care. We want people in pain to feel empathy from us, sympathy. But the more we open ourselves up to that, the more at risk we become for these symptoms. So you have to make sure there is a balance between your own self-care and the needs of the other person. Not coping with that or acknowledging that is going to create everything we just talked about. So I try to look at it as like, okay, I have a wide range of empathy I can give out. And there's a dial, right? When I want to offer more, I dial it up. When I need to offer less, I dial it down. And when you start to feel depleted, you need to dial it down, right? Really, anyone is at risk for this. But again, if you are a caretaker or someone who constantly neglects your own needs, a people pleaser, taking on more than you should, or working in a high stress environment, you're going to be more at risk and you need to really take care of yourself. Healthy helper does not apply so much, so I'm not going to go too much into that. But it really is a philosophy around this idea that you cannot offer other people anything good if you're not okay, right? So the idea is, if I'm going to be a helper, if I'm going to be in someone's life in a way that they need me, that they pull from me, that they require empathy and compassion, I want to stay healthy as a helper. And the way that I do that is to make sure I'm constantly aware and focused on my own needs, meeting them in a healthy and effective way, and creating balance between what I need and how much I give. And really looking at, are there areas in your past, present, current life that are affecting you that you're ignoring or acting as if aren't that bad? Are you in a place where you really need to acknowledge that there's some unresolved stuff? Because most of us are drawn to being a helper for a reason, which is we have our own stuff, right? And if you don't deal with it, if you're not a healthy helper, inevitably it's going to get triggered up when you're constantly working in a state of stress or dealing in a personal family relationship that's stressful. So you have to stay mindful that we can't expect other people to do what we're asking them to do if we're not willing to do it ourselves. So that's kind of the takeaway message that I hope you'll get. I know it's a little early, but it's an intense topic that I wanted to really make sure I left time for questions and, discussion or anything you wanted me to elaborate on specifically. I did put, I think Kim mentioned, if it's a personal issue that you don't want to talk about openly on the group, I'm happy to have you reach out to me individually and help with any support that you may need. But otherwise, I just want to open it up and see if anybody has any questions. I don't know, Kim and Bob, the best way to do that is that the chat, or can people unmute?
Yeah, whatever you're comfortable with. And first, let me just thank you, Jess. That was so phenomenal, so comprehensive. You give us such great, really helpful information. I feel like we could have spent an hour on every slide. There was so much great stuff there. Truly, I mean, it was just amazing. Are you comfortable sharing your slide deck with us that we can pass along to the folks on the program?
Absolutely. Yeah. It like you said, you could spend an hour on each one. It's so much information condensed into a short period of time. So I really make the slides for other people. I'm happy to have you share them out with anybody that wants them.
Right. I'm actually going to ask you if you don't mind to stop sharing, and maybe we can put your contact info in the chat if you don't mind. But
Sure.
I want to just make sure we see folks. You are welcome to either put your question in the chat. I see one already. Or you can unmute, raise your hand. Raising your hand is a great way to let us know you'd like to ask a question.
It's a bit of an intense topic, so it's hard,
It is, but it's so relevant, I think, to what I know. So many of these folks are doing such amazing work out there, and I loved the way you talked about burnout versus compassion fatigue, and really helped to identify those.
Yeah.
Differences.
Thank you so much, Jessica. It was very informative and very easy to follow.
Good.
And one of my areas of interest was attachment disorder. And I worked with teenagers. So they were already with families who had adopted them from other countries for 10, 12 years already.
Wow.
And the parents were traumatized both by the children's behavior and vicariously through the children's experiences.
Yeah.
And that was a big part of the work. And, because they're 100%. And as parents, we expect kids to give us back, at least until they start talking back.
Isn't that the truth? That's an intense job.
I'm going to have to add that to my book. That was a good line. I like that one.
There you go.
Give back till they talk back.
Yeah. That's a very intense job all around. I mean, intense for everybody to experience. But, it's like whenever there's an abandonment template, or even just a knowing, like you're too little at times when you're adopted to even know that there was abandonment, but there's almost this innate awareness. And then when it becomes a conscious awareness, it immediately creates issues around attachment. And so, this push-pull dynamic that occurs where people will ignore their own needs to stay in a relationship, or they'll reenact harmful patterns and dynamics because it's all they know how to do. It's very fascinating, but also incredibly sad for everybody that's in relationship.
And as you said, some are just resilient enough where that initial break in attachment from the mother doesn't really affect them because they go to a loving place where their needs are being met.
Right.
Others, however, and especially some of my kids from Russia and different places, grew up in orphanages and things where they didn't get that.
Yeah.
And so their brain, their worldview was, I can't trust anybody except me.
And rightly so,
And that never changed. I have a young man who's now a Bethlehem firefighter who was a Pennsylvania state cop for a while, but that wasn't exciting enough for him.
Yeah.
So he had to switch. But he still is, I'm doing it my way. Get out of my way. And his parents have now learned to live with themselves as the most beautiful people on earth because they put up with his intensity.
Yeah.
And just loved him when love was not enough.
Yeah. Even being a responder, right? It's like, family members become hyper vigilant. They don't know if you're going to come home at the end of the day. They don't know what's going to happen. They don't know what kind of things you're exposed to. I mean, thank you for what you do. That's amazing.
They don't know if they're safe or if the pets are safe even. Because pets are such a warm, loving thing. For some of these guys, love is too much, and a pet loving them leads to them hurting the pet.
Yeah.
Maybe even unconsciously. or subconsciously, I should say.
Yeah, it's so interesting, the wiring, you know. Thank you for sharing that, and thank you for what you do. That's a very important job.
I have a client with childhood trauma as well as traumatic grief that he endured a couple years ago. He presents extremely angry and very dysregulated. Family members of his are afraid of him. As a clinician, my first line of focus, I believe, should be rapport building and teaching emotional regulation skills. Anything else that you would suggest? He is 1 foot in and 1 foot out in regard to treatment.
Yeah, so I think you nailed it in terms of the trust rapport, because until a relationship imprint for you and this client get established around safety and security and trust, no other approach or modality is going to work, in my opinion. So that may take a good period of time, but I like the idea of also bringing in emotion regulation skills. I would really individualize it and empower it for them to have a lot of control over what those skills look like. Obviously, you're going to challenge them to be healthy and effective approaches, but it's really good around the empowerment piece because they feel like you're on their side, you're fueling something that they strive for, and also allows them to remind themselves that they are capable of these things. Now, once this client is a little more stabilized, I think EMDR could be a really helpful approach to kind of look at, are there any areas where these traumatic events or this grief is really stuck? Like, how much of this is behavior? How much of this is trauma manifesting? How much of this is development? How much of this is grief? Like, first, you kind of have to sift through and really get a sense of what you're dealing with here, right? Because it could be everything, or it could be one or the other. It could bounce around to different things. I also think it's important to help make sense of things for the client, right? Because when someone explains to us why we do what we do, why we reacted the way that we did, it helps us. We can take a deep breath and feel like, okay, nothing's wrong with me. Like, this makes sense. It's like you guys, when we're talking about it in this training, you're like, I do that, right? And then it makes sense. So it makes you feel a little bit better. Hopefully that helps answer that. I mean, it's pretty obvious that you are a very tough woman, a strong woman, a very skilled survivor, and he may not have had a trauma. I think sometimes we do this thing where we're like, oh my God, they're so distraught, they're so messed up, they're so progressed in addiction. Something must have happened, right? Like, there are cases where nothing specifically traumatic may have happened, right? There may, to your point, like being a genius, oftentimes kids who suffer with that, they feel constantly bored. They feel very misunderstood. They don't have anything that makes them feel fulfilled, right? They are really struggling and challenged around their sense of purpose. I mean, it's honorable that you acknowledge your own complex PTSD, and there may have been dynamics that he learned throughout your family system, which oftentimes is very unconscious and not intentional. Or there may have been untreated, undiagnosed mental health. And when people have that, they are 89% more likely to fall into addiction, because the second they touch a drink or a drug, it's going to meet a need for them differently than it would for somebody else who doesn't have an untreated, undiagnosed issue. It's like, whoa, I've been missing this my whole life. And then before you know it, hooked, and the progression occurs. And then you're dealing with not only your own history of trauma, but you're projecting on, like, what did I do? Did I cause this? How can I fix this? And then being a parent of a child who's struggling. I mean, it's a lot. And I think you're doing all the right things. The thing I always felt bad about with family members is the addict goes to treatment, they get intensive therapy, they spend all this time working on themselves, which is wonderful. But short of a peer support group here and there, family doesn't really get that opportunity. We actually started a weekend family retreat that is 10 hours of intensive trauma therapy work for family members, because we really wanted to create like something that gave them an avenue to dive into this generational spillover trauma stuff, that you're talking about. happy to give it happens once a quarter we do it. I'll give out the information if you like, but something like that would be really helpful because you'd be number one with other people who can validate and understand what you're going through, and also just kind of like give you the room and space for it to be okay. So one of the things that I really try to encourage is when you're looking at support groups, you want to stay away from ones that live in the war stories, right? So Al-Anon can be challenging sometimes, Nar-Anon can be challenging sometimes. I adore it. I've worked it myself, but people that are going to those programs are still in the suffering, right? So when they're in the peer support process, at times they're still living in the active trauma. So they're talking about it, they're feeling it, they're sharing it, and people are going into the graphic details of the experiences, which can then spill over and trigger other people. So it's really important that the support group have a facilitator or a group norm or an understanding that the focus should not be on the trauma itself, the horrific situation that's happening, but it's more about this is how I'm affected. I'm coming here because I can't go to work without being preoccupied that my loved one's going to die, right? I'm so depressed, I can't get about, like the focus has to be on how you're affected and less on the circumstances. Even with that boundary, though, it can create vicarious trauma because if you're very empathetic, you're going to want to help everybody in the group and you're going to want to show compassion to everybody in the group and share your story to help them feel relatable. And you just have to watch your own boundaries, right? Number one, you want to question, what is my motive here? Am I getting a hit off of this? Am I getting a payoff from this? And is this hurting me in any type of way? And if the ability to help is genuine, you can do it in such a way that it doesn't deplete you. And then make sure that you set a boundary and hold it. If God forbid this person starts to take too much or you start to give too much, really the best key I can tell you is awareness. Self-awareness is so important because these are unconscious patterns. We don't realize we're doing it until it's already too late. So the idea behind awareness is like, I can't intervene on what I don't see is happening. I can't fix something that I don't understand even occurred. So you have to constantly do check-ins and stay self-aware, like post group, did anything in that group really affect me in a way that was a little harder than usual? I think having a therapist in addition to the support group is so helpful for that, because then with the therapist, you can really process the vicarious trauma, the compassion fatigue, or anything that may have triggered you in a way that keeps you regulated and emotionally moderated and doesn't take you away from the benefits of the peer support. Yeah, it can be a tricky thing. I mean, as a facilitator, like when someone is sharing about a horrific event or a trauma, you don't want the person to feel shut down by being like, you can't talk about that. We're not going to go into war stories. So it's a very delicate thing, but you have to be able to redirect and educate like, hey, I hear you're about to go into a pretty difficult trauma story. I just need you to be mindful and aware that it could potentially trigger everybody else in the room. Can we shift more focus on what's going on with you? Can be a really good intervention.
Amazing. Right. Great stuff, Jess. Thank you so, so much.
Thank you, guys. Thank you for all your kind feedback. And I'm happy to be available as a resource for anything you might need. So don't hesitate to reach out individually if you have further questions or need resources for help or any of that.